Mr. Gagnon, can you please describe what pharmacist Jean Gagnon was doing with the eye medication Lucentis and why it was considered unethical?
In fact, he was getting bottle of that product as a liquid product. He was getting bottle from that product and dividing the bottle in three individual doses, in fact, syringes. So he was taking one bottle and making three syringes out of that bottle, which he was then each selling for the same price as the full bottle.
So would you consider this fraud?
It's an overcharge. In fact, the law is clear that a pharmacist, when a pharmacist is reimbursed by the Régie de l'Assurance Maladie, he should sell the product to the Régie, the drug, at the same price that he is purchasing it. In this case, evidently, Mr. Gagnon was selling it 3 times the price that he was paying for it. And even more, some of this drug during that period, Mr. Gagnon got it without paying for.
Did the doctors he was supplying the medication to not realize that he was doing something unethical?
Hard to say. If they would be looking at the drug and looking at the monography file with Health Canada, they would have found that the drug was sold only in bottle and the content of each bottle. So they could probably presume that Mr. Gagnon was dividing them in 3 syringes, but doctors are not really in a position to find out if it's legal or illegal.
Are there instances when a pharmacist can legally repackage medications?
Yes. There are. It's part of their profession to do that. There are many instances where they can do that. There are conditions to be met, though it must be in the interest of the patient. Generally, it must be upon request from an MD, a doctor, and it must be done in accordance with instructions which are filed by the manufacturer with Health Canada as to how to do that.
Did Mr. Gagnon's actions harm any patients?
Probably not, because the condition under which he was dividing the bottle in 3 syringes, according to an expert who testified in this case, were very high quality, and the health of the patient was probably not in danger in any way.
So his pharmacy has remained open now with his partner, Linda Frame, at the helm. Do you think doctors and patients may hesitate to use it to fill prescriptions afterwards?
It's very difficult to say what they will do. In fact, probably maybe some doctor will be more cautious in making sure that what is being done there is done according to the law. But as the health of the patient was not in danger, I think the pharmacy would probably be doing business as usual. But with this decision against the pharmacist, he has probably now a great interest into complying with the law.